Okay, so today we're going to be talking about how the elbow and the radioulnar joint is used in our everyday lives. Today the ADL that we're looking at is eating. So when you're doing this motion, a lot of times we're doing a lot of elbow flexion. When we're picking up or using a fork or anything, so a lot of elbow flexion, as well as some pronation and supination depending on how, what or how you're eating. And then also a little bit of shoulder abduction as you bring the food to your mouth. So we're talking about these actions in the elbow joint and a little bit at the shoulder joint as well.
Okay, in order to strengthen the muscles that are involved in eating, we first have to identify the muscles and the muscle actions they produce. So for elbow flexion, we're going to have primarily biceps brachii as well as brachialis and brachioradialis. For glenohumeral abduction, primarily going to have the lateral or medial deltoid. And then for pronation and supination, for supination, we will have supinator, as well as a little bit of brachioradialis. And then for pronation, we're going to have pronator teres, as well as pronator quadratus, and a little bit of brachioradialis as well.
We decided to come up with a therapeutic plan to help people who need assistance in eating. So we have two exercises that I'm going to demonstrate, and the first one is going to be bicep curls. So you'll take two light weights, but right now we have water bottles. And the first exercise that you're going to do is to strengthen your biceps brachii. And so you'll do some bicep curls. You're going to hold your light weights down and start an elbow extension. And then flex your elbows to bring them all the way up and make sure that you get the full range of motion with your light weights. And then the second exercise that I'm going to demonstrate is hammer curls. And so you're just going to rotate your hands inward a bit, make sure your thumbs are facing each other, and then same thing, start an elbow extension and bring those light weights all the way up, getting the full range of motion in your hammer curls. And this is going to strengthen your brachioradialis.
The next two exercises will be using a marker, but you can use light weights. So the first one, you want your arms at a 90-degree angle, and you will just pronate and supinate your hands, and this helps straighten the pronators and supinators. And then next is the lateral raises, which you'll just put your arms up and then back down, and this helps with shoulder abduction.
Perfect.